is my lung, thorax, and abdomen assessment, and I'm going to start with inspection of the thorax and lungs. I'm looking for asymmetry, any deformities, any use of accessory muscles when breathing or abdominal muscles, barrel chest or any clubbing of the fingers, and cyanosis of the skin. So none is noted. And now I'm going to do palpation. I'm going to feel the chest for any tenderness and expansion of both posterior and anterior chest wall, and it should be about 3 to 5 centimeters. And then I'm going to palpate for tactile fremitus. Let me know if there's any tenderness. Okay, deep breath. And now I want you to say the word 99.
99.
Every time I touch it.
99. 99. 99. 99. 99. 99. 99.
Okay. No tactile fremitus noted. Now I'm going to do percussion, and that will alert me to any pleural effusions, and I can feel for any hyper resonance or dull sounds. Okay. It went off, Steph. Okay, this is percussion. Same thing. Okay. And now for listening for any abnormal breath sounds, diminished lung sounds, and any like crackles. Take a deep breath. Okay, now for my cardio assessment, you want to inspect and look at the patient's skin color. Again, look for cyanosis, any varicose veins, any JVD edema. You want to check the nail bed for the capillary refill, and that should be less than 3 seconds. And all that is normal. And then you want to palpate the location of the heart and feel for any thrills and pulses. You can do peripheral, posterior tibula, the pedis pulse, the femoral, the radial, brachial, and carotid. Of course, you don't want to do those together. And note if they're weak, diminished, bounding, or absent. And to feel for the location of the heart. The aortic is the second intercostal to the right of the sternum. The pulmonic is second intercostal left of the sternum. Tricuspid is fourth intercostal space and left of the sternal. And then of course the mitral is mid-clavicular line, fifth intercostal space. And then you want to listen to those heart sounds in all those places for any abnormalities. You want to hear an S1, S2, love dub. You do not want to hear an S3, S4 murmur or any kind of click. palpating your pulses, you want to do 1 full minute. Okay, I'm going to have you lay down. Put your feet up. This is the abdomen inspection. You want to look at skin color and vascularity. You want to look for any lesions, rashes, the contour and symmetry of the belly, and any hernias and distension. Everything on inspection is normal. And for the belly, you want to listen first before you palpate, and you want to listen on all 4 quads for. Okay, and this is the abdomen inspection. You want to look at skin color, vascularity. You want to look for any lesions, hernias. You want to look at the contour and the symmetry of the belly, and movement if there's any distension or hernias that you can see. All that inspection is normal, and on the belly you want to listen before you palpate so that doesn't affect your auscultation. You want to listen starting with the right lower quad, moving clockwise for any hypo or hyperactive sounds. You want to listen for 15 seconds if you do hear noise, and if you don't, you have to listen for 5 minutes in each quad to have a full absent vowel sound. Okay? And you want to listen with the right lower quad first. For 15 seconds. Move into the right upper quad for 15 seconds. To the left upper quad for 15 seconds. And then the lower left quad for 15 seconds. And these are normal active. Then you want to do light palpation, starting with the right lower quad. Any tenderness? Any tenderness?
No.
Then you want to do deep palpation. Again, starting with the right lower quad and moving clockwise. Any tenderness? Okay, you want to know any masses, enlargement, or pain present on palpation. And then you want to palpate the kidneys. Both right and left. And then when you're auscultating, you also want to listen for the renal, any renal thrills or bruise that you